I would like to thank you all for making time. I thank our moderator, the capable Professor Fred Wawide, and our excellent presenters of the day, Dr. Goreka and Professor Bachwayo. I'm sure that we're going to find this webinar enriching and quite interesting. We have also requested that we activate the chat room so that people can be able to follow the instructions that our moderator gave us, so that we know who is online and that people are able to interact with us. I believe that, and I hope that the chat room is now active. And it would also be great to see your face, Professor Wawide. I hope that the IT people will be able to activate the videos as well. So thank you very much, and I wish you all a wonderful discussion, and we look forward to having you in the next series as well. God bless you all. Over to you, Professor Wawide.
Thank you very much. Thank you very, very much, Executive Director AfriChild, Mr. Timothy Opobo, for those welcome remarks, and also for flagging off this first series, the first episode in a series of webinars. Going right ahead, I will begin by introducing the first speaker. The first speaker is Dr. Goreka Akahabwa, who is a clinical psychologist with more than 19 years experience training at the university level. Dr. Okahabwa holds a bachelor's degree in zoology and psychology, a master's in clinical psychology, both of which are from Makerere University, and a doctorate in clinical psychology from Regent University, USA. She has worked as a university counselor, lecturer, senior lecturer, and coordinator of counseling programs at the Uganda Christian University. She's passionate about psychology and research, and has contributed to training in research methods for both students and staff at UCU, and has also led research teams as the principal investigator. She also provides child and adolescent clinical psychology services. Dr. Okahabwa will present on contextual factors for peer victimization of high school students in Mukono, Uganda. Dr. Okahabwa, please go ahead with your presentation. I hope you are able to share your slides, and I hope you have unmuted and test so that we can hear you. After your presentation, I'll then give further instructions on how we shall proceed with the webinar. Over to you.
Thank you very much, Professor Wawide. Can you hear me?
Yes, I can hear you, and I imagine the others can also hear you.
Thank you very much for this opportunity to share the research that we did as the team from UCU. The title of the research was Contextual Factors for Peer Victimization of High School Students in Mukono. And like I said, it was a team from UCU. Those are the people who were involved. As the definition for peer victimization in our study was cyberbullying, any victimization including devices, social media, phones, that kind of thing, and physical and emotional peer victimization. From the literature, we found that peer victimization is a growing health problem among the youth, not only in Uganda, but all over the world. And it has been observed in multiple contexts, which we saw as the school, the family, and the community. The objectives of our study were first to determine the magnitude of peer victimization, to explore the lived experiences and investigate the perceptions of the students who were actually involved, and to compare the magnitude of peer victimization by contextual factors among high school students. Our approach was the mixed methods, specifically the parallel concurrent design. So we did both the qualitative and quantitative at the same time, running concurrently. And the methods we used were the focus group discussions, interviews, and questionnaires. Our population was high school students in government schools in Mukono, and we selected the sample using a strata from schools, the different kinds of schools, the day schools, boarding schools, day and boarding, all female, all male, and co-educational schools. So from each of these strata, we selected the school with the highest population, and our final sample size was 338 students. So we had, from the schools that we had selected, we had students from each class, and students from 12 students from each class, totaling to about 72 students from each school. This being a study sponsored and as part of our child-focused research training, the children were a major part of the whole study. So we involved the children in the pilot study. They were the respondents and participants for the interviews and focus group discussions. They helped lead the focus group discussions. They gave us general support during the field work. So we would go to a school and the children were in charge of helping us get the people who had been selected, organizing the places where we would sit, and generally they were a very big help. Then they participated in the dissemination of results, and they are the focus of our recommendations. The tools we used were partly tools that have been adapted, that have already been used in different places in the world, and we adapted them for our situation. So the questionnaires were a combination of the multidimensional peer victimization scale, the bully survey student version, the cyberbullying and online aggression survey, and the exposure to violence and violent behavior checklist. These are all available in public media. So if you wanted to do a similar study, you'll be able to access them easily. The interviews and focus group discussion guides were developed by the team, and these targeted the S3 and S4 students. We did obtain ethical approval from Gulu University Research Ethics Committee and the Uganda National Council of Science and Technology. We also got administrative clearance from the different authorities in the areas, the schools to begin with, then the ISO, the DEO, the RDC, and the COWS in the district, in Mukono district. For the respondents themselves, we had respondents who were below 18 and those above 18. So for the ones below 18, we did get consent. For all of them, we got consent from the school administration. And then we got assent from the students below 18, and then consent from the students above 18 and above. We explained to them that they were free to withdraw from the study at any time without any consequences. Their information was, we were going to keep their information in confidentiality. We didn't ask any respondent to give us particulars, names and things like that. And then we also put in place a plan to manage any risk. Each of the teams luckily had a counseling psychologist as part of the team. So we organized it in such a way that if there were any issues that came up that needed immediate management by a counselor, that the counselor would withdraw from the research data collection and deal with whatever and be able to attend to the students, any students who needed help at that point. And this happened a number of times, and we were glad that we had put that in place from the beginning. Then we had a mentor, and we had other colleagues who were in the same training. So the quality, we were helped on that note of a quality control by our mentor and other professionals who are in the same training. So coming to the results, the picture of the group that we had, they were both male and female, 43% male, 56.2% female. The ages range from 13 to 23 years with a mean of 17. The boarding schools, the schools included all boarding and mixed day and boarding. We had originally planned to include an all-day school, but we didn't find any. It seems even the ones that present themselves as day, as some have boarding components, so we didn't find any totally day school. And then we had all male and all female and co-educational schools. So this is the picture of the respondents we had. So for objective one, in which we're looking at the magnitude of peer victimization, we found that peer victimization was evident in all the different contexts, all the school contexts I've talked about. And then that more than half of the respondents reported no experience for each of the respective categories of physical victimization, contrary to what we see when stories come up in the media and a case has been reported in a school. Sometimes they make it appear that all schools, every child in every school is experiencing some of these forms of violence. But we found that more than half of the respondents reported for many of the kinds of victimization we're looking at had never experienced them. And then we found that the experience of cyberbullying was low. For the second objective, looking at the lived experiences of the students, they reported participation as perpetrators of peer victimization, and they noted that the power imbalances played a big part in this. Students who are looked at as big boys or big girls were very often the perpetrators. Then they reported on their participation as bystanders or witnesses of peer victimization. Most of them said that when they witness incidents of victimization, they were afraid to intervene at that moment, but they usually would, if they feel confident enough to approach the perpetrators later or approach the victims later and comfort them. Then they talked about their experience of cyberbullying, physical and emotional victimization, and also sexual victimization. So the issues that came up here were issues of being made fun of by other students. A particular respondent talked about their skin color being the cause of their victimization. Other students do not want to talk to them or not want to sit next to them. They also talked about their experience of the consequences of cyberbullying, physical and emotional victimization, which included lowered self-esteem, fear, and not wanting to be with others, the fear to communicate and be with other students, especially those who had been the perpetrators. And then they also talked about survival and support mechanisms by students, the family, and the community. And they noted that students, the family, and the community were usually the perpetrators, but they were also the support and the means of survival in situations of peer victimization. Concerning the perceptions, the way the students saw the whole issue of peer victimization, they talked about the causes and perpetrators of peer victimization. So this is how they see what is going on. Many of them talked about parental conduct being and encouraging the children themselves to be perpetrators. They noted that when parents at home are violent, aggressive, children are more likely to demonstrate these characteristics even at school through peer victimization. They talked about older siblings victimizing younger siblings, and then this continuing on even at school. They talked about differences in class, in tribe, in appearance, in body weight. And they said when children notice the differences and maybe they seem to be negative, they usually become the brunt of peer victimization, especially emotional victimization, being laughed at, being called names, being teased. And then they said the community doesn't seem to help in preventing or very often doesn't seem to help because, for example, let me read the quote. It says, the community just encourages it. Someone posts a funny picture about you or someone just reposts it. Even if it is someone's nudes, as a community, why do you keep reposting them, forwarding them to other people? So this is one instance in which they said the community continues to perpetrate the peer victimization because people receive negative maybe pictures or posts that are really peer victimization, and then they continue posting them to other people who did not receive them in the first place. Then they noted that student relationship difficulties contribute a lot to peer victimization. gossiping, rumor mongering, love relationships, which they called coupling at school, gone wrong, then they result in peer victimization. So from their perspective, these are the things that cause peer victimization and also the perpetration of it. For objective 3, the consequences of peer victimization, in their opinion, many of the respondents said that when people are bullied, they become bullies. So there's some work that has been done and some research that has been done, but what they could see was very often the people who were teased or bullied as they came into school ended up being bullies themselves later on, to kind of make people feel what they went through. They talked about the consequence of fear. One respondent said, you reach an extent whereby you start fearing everyone that comes near you. And then they also mentioned low self-esteem, self-hate, and lowered academic performance. On the point of lower academic performance, they said some children come into secondary school and they're excited about school and they participate in class, but when they have been teased, especially when they say something wrong in class, and the whole class laughs and maybe they're teased about it afterwards, they lose the confidence to speak in class or to ask questions, and so they become their academic performance is reduced. Their perceptions on the management of peer victimization, they had a few ideas. They said students should start with the students being nice to each other, not being considerate of the feelings of other people and not being the perpetrators themselves. They also noted that more avenues to report should be provided. If it's within the community, maybe hotlines might be helpful for anyone who is being victimized to be able to call on a hotline and get the help that they need. They also noted that schools should increase on the discipline among the children, but also should punish those who are perpetrators, so that other people will not be encouraged to be involved in perpetrating peer victimization. On the note of parental involvement, many of the respondents noted that many parents are not positively involved in dealing with peer victimization. Very many parents tell their children, you are a big child now, go and deal with it yourself. Some respondents told us their parents say, let's pray about it. Let's pray that it will change. So their perception of the parental involvement, what it should be, was that they should be more involved. They should be able to train their children to deal with this, but they should also be positive and not blame the people who are accused even falsely. And then they suggested guidance and counseling programs, because they thought if there are guidance and counseling programs within the schools, they should be able to manage peer victimization. The encouraging thing was that schools that we went to, some of them already had this in place, and they were beginning to use the guidance and counseling, the teachers or the counselors who had been placed in these positions. For objective 4, this was comparing the different contexts as far as peer victimization is concerned. So we found that peer victimization was evident in all contexts. Where we've presented this research, some people wanted to know which one is better. Where can I send my child? We are afraid we can't tell you that at this point. All the different school contexts showed evidence of peer victimization in very varying degrees. There was the experience of emotional peer victimization, which showed higher amongst the girls than boys in all the contexts. And this has been shown in prior research by Always. The experience of physical peer victimization was higher amongst the boys than the girls, which also is the same as results from other research that has been done. We found that emotional and in particular verbal victimization was notable in all the different contexts, which was an interesting find. We realized that a lot of work has been done in fighting physical victimization, but it appears that emotional and specifically verbal victimization has not been tackled to that level. So it appears what used to be physical victimization has now morphed into emotional verbal victimization. We also interestingly found that stealing, which is as a form of victimization, was notable in all the contexts, all the school contexts, all the the family, the community, and the school. And for these last two things I would like to encourage anyone interested in doing some of them, and we hope that we can do additional work in finding out why this was so. So our conclusion is that peer victimization is present in all the contexts. The differences in magnitude of the experience of peer victimization between the school contexts was not remarkable. As I said, we cannot recommend that one is much better than any other as far as peer victimization is concerned. We found that most schools have policies and systems in place to address peer victimization after the fact, but not before. So they have laws, regulations. When peer victimization happens, this is what should be done. But not very many, we didn't find real programs on the prevention, on the prevention of peer victimization, or what can be done to stop it happening even before it does. The students, schools, family members, and the community were noted as promoters of peer victimization, but the support against peer victimization also came from the same people. So we think there is need to sensitize school staff and parents on prevention and intervention in situations of peer victimization. One of the questions we asked was, what do you do when you witness peer victimization? Or if you are a victim? And they said, we go to the teachers or we go to the staff. But the area that seemed, with physical victimization, there are guidelines on how to deal with it. But emotional victimization, there didn't seem to be any guidelines on how to deal with it. So it would help if staff and parents were sensitized and trained on how to deal with these situations. And then we realized that more research is needed on emotional verbal victimization and stealing, which we found were notable in all the contexts. So our recommendations are that the current policies on zero tolerance of bullying and no phones in school, especially in boarding schools, be maintained. They seem to have reduced, they seem to have limited or at least capped the levels of cyberbullying in school, because students do not have access to the phones or to the devices when they are at school. Then we also recommend that students have a fair and just hearing when accused of victimization. We had a few stories of students who had been expelled or suspended when they had been accused falsely. But because the system was in place and they went from one step to the other, in a period of 2 or 3 days, they have already been suspended when actually had been accused falsely. Then we recommend platforms to be created and supported for people who have either experienced peer victimization and cyberbullying, and also for them to be able to sensitize the students who are coming in who may not have yet experienced it or who have already been victims. We think there's a lot of power in students being able to support each other in this difficult situation. And then we think there should be a sensitization on consequences of emotional, specifically verbal victimization, in addition to physical victimization. We know that there has been a lot done on physical victimization, but not so much on emotional or verbal victimization. And we know that emotional victimization has very far-reaching consequences. Some of the respondents told us that they would rather be beaten, given chiboko, than the kind of words that are said to them. They said, you remember these words years and years later. It would be better if someone just gave you a stroke of the cane and you feel the pain and you forget about it. So more sensitization has to be done on the consequences of emotional and verbal victimization. And then equipping teachers and school staff to address peer victimization, sensitizing and training parents to address peer victimization. Like I said earlier, many of the students said, when we mention peer victimization, our parents don't want to be involved. They say, go deal with it. Or if they have been accused, they say they don't ask whether it is true or not. But so for parents to realize that this is something that is going on and that they have a part to play in helping children understand what to do and be able to deal with it effectively. Then strengthening the monitoring of the use of social media or devices and the internet with the increase of online study. So we realized that since the lockdown during COVID, more and more schools, organizations, institutions are using online platforms for work, for meetings, for the schools, the institutions, the schools, the secondary schools. Many of them use them even during holiday time to send holiday work, to keep up with the students. So there needs to be some way of monitoring how these are being used. If the children are going to use them, the students are going to use them for school, there needs to be a way to monitor that they are not misusing them to using them to bully other children, to send pornographic material and other things which are the different ways in which cyberbullying is seen. So monitoring the devices or the use of them, even as they are used more and more for school. So that was our study, and I would like to acknowledge the AfriChild Center, Uganda Christian University, and our research assistants who were Joseph Tenywa, Nicholas Agawa, Grace Kesande, Mark Enipo, Martina Ajulu, and Dixon Tumuramie, and for the work that we did during for this research. Thank you very much, AfriChild, again for the opportunity to complete the training, do this research, and to present this research to you today. Thank you very much.
Thank you very much, Dr. Goreka Akahabwa, for that very, very excellent presentation. I'm sure there are comments and questions which I would like to take in a coordinated way. And I think we shall begin. What we'll do is please raise your hand, and then I will give you permission to make your submission so that you can then go ahead and unmute. Are there any hands? Unfortunately, we are running out of time, so we can give only a maximum of 5 minutes for questions. That means about 4 or 5 questions. Okay, there is one hand. I see Tumwebaze Jonathan. Please unmute and go ahead and make your submission.
Thank you very much, Prof. I hope you can hear me.
Yes, we can hear you.
All right, thank you very much. I'd like to appreciate the team for the wonderful work that has been done. I really appreciate that. But my quick question, or rather that could be something that could that the team could think through, is that the policy space for your work. It's very good work, but I think listening through the presentation, it could be in the major work, but I miss out the policy niche for the work, in a sense that there are different spaces, policy spaces, the invited spaces, the created spaces. So I'm just wondering, which kind of space are you appealing this work to? Is it at the district policy making stage space? Is it at the national space? If it's at either spaces, what kinds of policies are you appealing to, so that you can be, at the end of the day, be able to create the impact that AfriChild seeks to promote in the kind of work that is done? So I missed out that angle that I think that the team can be able to pull through. And then lastly is with regards to, I think it's very exciting to look at peer victimization. I was very interested in the parameters, or rather the variables that you pulled through in terms of conceptualizing peer victimization. And I was looking forward to maybe to see those variables being presented. Let's say if it is things to do with cyberbullying as one of those parameters or variables that you pulled out, what are the specific scores in terms of the effect of specific variables and how they are playing out. And I was looking forward to how those specific things under peer victimizations are presented in terms of even private schools vis-a-vis public schools, rural schools vis-a-vis urban schools, to see how different forms of victimization play around in those areas when it came to presentation of the data. But thank you very much.
Okay, so thank you very much, Jonathan, for those two questions. Going forward, I think we shall allow one question per person and then make it short. So what we are going to do, Jonathan, is we'll go to the next question, and Goreka will be given an opportunity to respond or react very briefly to what you have posed. Can we ask Polycarp Omara, please, to go ahead, unmute, and make your submission?
Yeah, thank you, Prof. I hope members are getting me.
Yes, we can hear you.
Yes, I want to appreciate the presenters for this good work. I would like to seek clarification when the presenter was making a presentation, especially on the perpetrators. There was a mention of parents as both perpetrators and those who rescue children who are victimized. I don't know what percentage where those parents were perpetrators against those who were acting as saviors of the children being victimized. Thank you.
Okay, thank you very much, Polycarp. There are also some questions in the chat, in the Q&A chat. And there are quite a number, so we'll take them very quickly. When you said cyberbullying was low, what was the quantitative level? That's a question from Kizito Omona. Then from David Okimait, did the findings indicate the role of educators within the school spaces? Goreka, I'm trying to read very slowly so that you can hear and follow. Then what were the levels of emotional and physical peer victimization in the survey? So those are the questions, Goreka. As I mentioned, we don't have to answer all of them now. You can answer some of them online because of time, but is there any comment that is very urgent for you to respond to?
Okay, I will answer the ones online as we continue with the presentation. Let me answer the ones that have been asked. Thank you, Jonathan, for those questions. Thank you for bringing up the idea on the policy space. Yes, we were thinking about school policies, district policies, national policies. The school policies at the moment that we mentioned were the no phone policies. So we recommended that under zero tolerance, which is nationwide, we recommended that this be maintained. At the level of national as well, the idea of thinking through what to do with the use of the internet and social media platforms in school, that would have to be at the national level. So yes, thank you for noting that. We will include it a bit more clearly. I acknowledge it wasn't very clear. Then you talked about the specific scores. As you realize, we had 15 or so minutes to present this. The report includes a lot of numbers, a lot of quotes from students, and the information, all the information that we have been able to present here. So yes, we did get specific scores of some things that you were talking about. We looked at the different cyberbullying, emotional bullying, and physical bullying. We did not integrate them into one score. We looked at the things that make up cyberbullying or physical bullying, emotional bullying. So if you look at the report, you will see how each of those come up in the different situations. Maybe someone who would want to take this study further, or if we do ourselves, we would want to develop that gives a figure, maybe a figure for physical victimization, and then we'd be able to do a bit more with it as far as the quantitative analysis is. But for what we did not integrate the different components of physical or emotional or cyberbullying as one score.
Okay.
Then the third one, we looked at, our study was focusing on peer victimization. So we did not consider perpetration by parents or perpetration by teachers, but in the support or in the encouragement of peers victimizing their fellow peers. That was what would come out if it was perpetration by parents, but not the actual perpetration by parents. So we focused on peer-to-peer victimization, not either teachers or parents.
Okay.
Yes.
Thank you very much, Dr. Goreka. Ladies and gentlemen, join me in applauding Dr. Goreka for that presentation. And thank you, those who have asked questions, both physically but also online.